Hello, good day. My name is Kimberley Anneveldt. I'm an MD and PhD candidate in Isla Hospital, the Netherlands, and by giving this presentation, I would like to give you an insight in what we have been working on in Isla with regard to sustainability of uterine fibroid MR-HIFU treatments. When I say we, I refer to our dedicated MR-HIFU team, including gynecologists, radiologists, and researchers, and we have nothing to disclose. Within the Netherlands, the healthcare sector is responsible for at least 7% of carbon dioxide emission, which is one of many greenhouse gases responsible for climate change, global warming in particular. And this development results in decrease of sickness and even death. And therefore, our healthcare system is part of the paradox leading to more sickness. Fortunately, more attention is paid towards the impact of healthcare to climate change, and several sustainability projects have started already. To be able to decrease the greenhouse gas emission, it is important to get more insight in the amount of greenhouse gas emission caused by products or processes within healthcare. The way to calculate greenhouse gas emissions is by performing a life cycle assessment, or LCA. The LCA includes 4 steps. First, setting a goal and scope, and very important, boundaries, since it's not feasible to include all elements of the next step, which is the life cycle inventory. Databases can be consulted to find the outputs of the included elements of the lifecycle inventory, and next, in the third step, a lifecycle impact assessment will be performed, including all this data. Finally, the outcomes should be weighted and evaluated. For example, when we would like to compare the carbon dioxide emission of 2 types of gloves produced in the Netherlands, a disposable and a reusable glove, the lifecycle inventory could look like this, and we should consult a database including Dutch data of all these elements to make this comparison. In our case, we wanted to start with getting more insight in the sustainability of uterine fibroid MR-HIFU treatment. In the Netherlands, we use the SonarLeaf device, and unfortunately, treatment is not reimbursed yet. Therefore, Isla Hospital started a randomized controlled trial 2 years ago, the MyChoice study, comparing MR-HIFU to other standard care treatments, and to gain reimbursement. More information on the MyChoice study can be found in our published study protocol. The sustainability study we performed is part of the MyChoice study. We performed a life cycle inventory after setting our goal, the carbon dioxide emission of uterine fibroid MR-HIFU treatment performed in our hospital. However, as you can see, this includes a lot of elements, and since LCI databases often lack medical products, it would not be possible to perform a complete LCA. We decided to include the elements that we expected would differ most from the standard care treatments that are part of the MyChoice study. This included electricity used during treatment by the MRI scanner and MR-HIFU device, the medication used during treatment, and a waste audit. We were not able to measure energy used, but we retrospectively calculated average duration of different activity modes of the MRI scanner based on 25 previous treatments and multiplied this by energy used based on the literature. We consulted the vendor of the SonarLeaf to be able to do the same for the MR-HIFU device. The total energy used could be calculated, and this was multiplied by a carbon dioxide equivalent conversion factor based on a typical Dutch general energy mix. Next, again 25 treatments were retrospectively analyzed to calculate average dosage of used medication. Only medication used by a minimum of 5 patients was included. Of most medication, no conversion factor is available yet, so in these cases we use the previous published average. Finally, we collected all waste during 5 treatments and sorted the waste in different categories. Again, no conversion factor is available for most of the categories, so we could only calculate carbon dioxide equivalent emission for the gloves used. The total amount of carbon dioxide equivalent emission we were able to calculate for one uterine fibroid MR-HIFU treatment is over 38 kg, which is comparable to flying over 200 km by airplane. The amount of waste after one uterine fibroid MR-HIFU treatment is almost 14 times lower compared to the often performed alternative uterine fibroid treatment, the hysterectomy. With this study, we took the first step in performing an LCA for uterine fibroid MR-HIFU treatment. We only included 3 elements. To be able to perform a full cradle-to-grave LCA, LCI databases, including healthcare data, should be developed and open access available. We do believe LCAs will become standard procedure in future comparison studies, next to clinical effectiveness and cost effectiveness, since this will help decrease greenhouse gas emissions and therefore climate change. but will also help both physician and patient in making more sustainable decisions. And all will help in counteracting this healthcare paradox. Thank you very much for watching this presentation. Please feel free to contact us in case of any questions or suggestions. We are more than happy to discuss on this topic with you.